So I'm gonna take you through my routine that basically I'm gonna take you, routines are created based on knowledge that you've already gained through repetition in your practice. And through repetition in your practice, you gain an understanding of how to unlock certain parts of your body. This is different for everyone because everyone is coming to this time, to their mat, to their practice with different injuries and different limitations in their body. So the best way that I can explain this is, this is not definite for everyone. You should consult a physician. I am not a physician. This is just me sharing information I've learned based on spending thousands and thousands and thousands of hours in my own body and exploring how to live pain-free. Maybe not pain-free, but with grace, with ease. Okay, for me, I have a history of some neck issues. So I've had to learn through many years, sequences that help relieve that specific injury in my own body. That's what brought me to yoga. That in itself is what brought me to the ground with gravity, exploring. Yoga is nothing but stretching. That's it. It's math, it's anatomy, it's stretching. It's very specific. If you have not spent time doing this on your own, then you're limiting your experience in this world. It is like a sense that you must develop through continuous practice, through continuous discipline, through repetition, like gymnastics, like reading, like language, like math, like any sort of system, like anything that you become a master of, you have to spend time. Lots and lots of time. Your body is an instrument. Your body is an instrument and it must be in tune. It must be in tune. To be in tune, it must have a certain type, adequate nutrition, certain types of food. Okay? Just like an instrument. If you're playing an instrument in a certain, say you're playing a stringed instrument in a very cold place. The very cold place is going to sound very different than the very hot place because wood warps. Okay? So, your body is similar. And you can think of the muscles like strings, okay? And they slowly can release. But the more you play it, the more you move them, the more space you get. So the function is alignment on both sides of the body. On the anterior, the front, and the posterior, the back. Also, three-dimensionally, medially, laterally, inside, outside. So, it's like pruning a bush, okay? When you prune a bush, you do not just prune one corner of it. You have to treat the entire three-dimensional space of the body. This you learn based on deep silence, focus, repetition, cleansing the body, breath, mindfulness, but that becomes selective because let's leave it there. So here is a routine that I will use to, right now, I'm feeling like my left side of my neck, my shoulder, into the middle thoracic portion of my back are very tight. Related to the heart, related to the lungs, related to the chest, related to the neck, and the head, and the eyes, even the hips. So, this is helpful if you spend a lot of time on the computer. This is helpful if you stand over a table all day, like me. Think about surgeons. Think about anyone who stands over a table. Working with clients, working with patients, working with people. Anyone who, maybe you're just tall and you have to look down at people all day. This is helpful in a lot of different ways. I'm just describing based on my own limitations in my body. This is the knowledge that I have gained. So, the first thing I notice is that I need to roll onto my hip. I need to roll up. I need to tilt my pelvis up to create space along the backside of my leg. And doing that gives me more space in my upper body and in my neck immediately, which is why my arm just popped back in place. So right now what I'm trying to do is I'm trying to release my occipitals and my scalenes in the front of my neck, my pecs, my rib cage. But by doing that, you also need to release very deep spinal muscles. And we'll keep it there. So this is very simple. This is a very easy way to address postural imbalance in the hips. And you want to start in the hips and slowly move up to the upper body, because your hips are your foundation for everything else. Your pelvic bowl is the alignment center if you have gravity here, okay? And your spine kind of floats based off of where that alignment of the hips are. So I can already feel it immediately. And what happens is I start to feel it in my upper body. And by moving my arms like this, I'm releasing my neck, and I'm challenging those muscles to, right now, they're so tightened and forward. So they're very long. It's on the posterior side of my neck. They're very long, the back, and they're stuck. They're not contracted. So I want to free up space so that they can relax, so they're not in a state of chronic holding, basically. So, and not everyone will be able to do this, and that's okay. That I will keep teaching and showing you how you can do that. For now, this is where we start. Now you're also going to feel this in your QO. You'll probably start to feel it in your feet. And it really depends on your body. You're going to feel it in your lats. And maybe you won't at first. But if you spend enough time, you will find it. And this is different than actively building strength. This is releasing dysfunctional patterns, dysfunctional holding patterns. This is structural. Because first, your structure, first you need to work on the deepest portions of your form. And once you have that, you can add muscle. You could add muscle now. You can add strength now. There's no reason why you cannot. You can do both simultaneously. But in flexibility, with continuous conditioning, continuous repetition of muscle, if the structure of the body has not been released or aligned, will eventually lead to some sort of tear or some sort of injury. Maybe it doesn't, in which case that's great. But if you can balance all of the planes of the body, and if you can learn from internally to the external, from feeling to moving, okay? From feeling to moving. Your body is your teacher. Your body is your teacher. Your body will tell you what to do and what not to do. And you will be much better at receiving that information if you're eating the right foods, if you're cleaning the body, cleansing the body. Because then you can feel it. And you can notice when you're about to hit an edge that you should not cross. Sometimes you can't, even if you are in your body. Things happen. Athletes, professional athletes, they hurt themselves too. And they live in their bodies, you know? We all have certain histories, certain traumas, certain injuries. Sometimes we don't even realize that something that we did affected us so much. And then one day we remember, or we never remember. Okay? So you always want to start on the ground. The ground is your best friend. Clean your floors. Clean your floors. get on the ground. You don't need a gym. You don't need to go to the gym. I promise you, the gym floors are disgusting. You don't need a gym. All you need is a towel. You don't even need a towel. You don't even need it. Okay? Right now, what I'm feeling in my body, my hamstrings, my adductors, and the inside of my leg, where else am I feeling it? The side of my hip, on the side of my back, my QL. I'm also feeling it in my neck, on my right side, in my neck, on my left side, in my deltoid, in all of these muscles, okay? You don't need to know the muscles. You don't need to even know the names of muscles. All you need to do is be still. And when it gets hard, and it feels like you cannot keep holding it, you use your breath to stay there. You train your mind to stay there. It will get uncomfortable. These long holds will get uncomfortable. They can be uncomfortable. If there's pain, do not hold it. If there's a sharp pain, get out of the position. Listen to your body. Your body is your teacher. And over time, you will develop an understanding of how to move in ways that facilitate a deeper release in a similar posture, which is why you see me moving like this. As I'm doing this, my shoulder joint is opening. I'm able to feel the tension in my neck more. I'm able to feel how tight my jaw is. I'm able to feel how much pressure I have around my eyes. This is hard. Holding my arm up like this is hard. This is not easy. It's like holding a weight. It is very similar to holding a weight. And I try to just make micro movements to encourage flexibility in a range that is comfortable. And that's normal. Your nose is going to itch. So, you do not need to be an expert in anatomy. It helps. It definitely helps to understand how and what is going on. But if you can understand your body first, inside out, from the inside out, through exploring it, through spending time with it, then when you go to learn anatomy, you will have such a better understanding and comprehension and retention of that information. See, this side for me, and a lot of people, is difficult. This right side. I'm right-handed. I drive with my right foot. We all drive with our right foot. There are certain patterns that come up over and over again in our society's bodies. That's because we have similar habits. This side is very different. On this side, I need to bring my leg out a little bit more. And what's funny is I came to this to release my neck. But why am I working on my lower legs and my hips? Because I know, based on having done this many thousands of times, that if I start here, I will get more here. Your body's musculature is attached in chains. So, muscles are not separate from other muscles. They are connected to each other. Thus, certain parts of your body that are on your lower body connect to your upper body. This is something I see a lot when I have clients who come in and they say, I have pain here, I only want work here. Okay, that's great, but let me try to educate you very quickly, and let's start here, which is a place that's totally separate from that area. Now, that's another topic, but still important to come to. This is where it's hard for me. And where I'm feeling this the most is right here, my pec attachment, my pec minor, my SCMs, my deep neck muscles. I do also feel it in all the way to the base of the skull. And that's where I'm trying to open it. I'm trying to open that area because on me, that's where I have a little, like, kind of a blockage in my disc. Now it's slowly opening to my rhomboids. I can feel my rhomboids, which is right in between your scapula and your back. Your wings of your scapula and your back, I can feel that opening and shortening. So maybe you're not a visual person, which is also fine. Maybe I have to move a little bit. And I challenge you to just use gravity. You don't need weights. If you can't resist gravity, you should not be using weights. Not that you cannot. Not even that you should not. That's too definite. And I can be that way and not, seem to be. But you will get so much more out of first building this range of motion and then adding weights, and then going into your body weight practice, whatever it is. I can already feel my neck releasing as my discs pop. Not fully, but I can feel them moving. right? So I'm gonna go back. And what happens now is I can move my leg back a little bit more, and I feel more focus around the top of my QL, more medial to my spine, and the rotators of my spine. Again, since this side is my challenge, this back side, and a lot of people's, because a lot of people are not left dominant, and we chronically do everything on the front side of their body like this, so we need to open our bodies like this. And what does that look like? Let's go back to the same side. Right in here. These are coming closer in. This is shortening, so it's not so long from looking down. Shortening, shortening, opening up. Your collarbones are expanding, getting wider. All in here, shortening, shortening. Thus, hips aligning. I feel it in my pecs. You feel it? Look, I hear my neck cracking. You will feel it in your whole body. So now I feel like I'm not timing this, because it's based on feeling, and it's going to be different every day. It's going to be different every single day. And I don't do that every single day. There are times in your life where you might build that routine, but as life is, it comes like this. But you still have to be able to come back to that knowledge, because the thing is, the body never forgets. The body does not forget. And you will remember that feeling. You'll instinctively know where to go. Okay. So once you've done that, you're going to scratch your ear. You're going to get some water. Now, this is an important part. This is one of the fastest ways to release your neck. Absolute fastest way to release your neck. You're gonna sit like this. If you cannot sit like this, then you're gonna sit like this. And you're gonna work to tilt your pelvis forward, so that back here, you feel it turn on, like you're about to go back. You could put something underneath your ankles. But whatever you're wearing needs to be very freeing, very breathable. Even these are too tight for me. Very breathable, high on your waist. This is above my stomach. My belly button is here. The tops of my hips are here, okay? This is 2 inches above my hips. So, me, I can sit on my heels, not a problem. That has taken a long time. So, I'm gonna hold my arms out. Basically, you kind of just feel out what feels right on your ankles. Look at your legs. How do they feel? Bring your hips forward. Feel that underneath. You want to start at the base of your spine. Feel that underneath your shoulders, right in here, and slowly work your way up. Notice your neck. Notice how rotation feels. Or does it feel stuck? Or does it feel tight? And you're gonna have to move like I'm doing right now because your body's gonna adjust. If you have pain, if you have any sharp pain, stop. Okay? I'm gonna get over here because I'm gonna bring my arms out. This is why I like the towel, because the towel is helpful for my ankles. Okay? First thing I'm doing, look, you can't see it. First thing I'm doing is this. Now, when I do this, I shrug my shoulders up and then I slowly bring them down. I'm bringing my hands in a prayer. I'm noticing the sensation of my palms touching each other. And I'm trying to push the feeling in my palms together. I'm not pushing hard, but I'm noticing them touching each other. And in doing that, I can feel the backside of my arms and my neck kind of just aligning. So I'm just gonna try to stay here, even though it's difficult. It's difficult. Because I'm someone who uses my right arm a lot in the work that I do. And so my right arm has all of these compensation patterns. Thus, so does my left side. Anyways, you can see how I'm moving like this. I'm opening my rib cage. I'm opening my spine. And like you see, each side is different. Just move the way that your body wants you to move, okay? Now, I'm gonna give my right side some attention. Because my arm, like this, I spend a lot of time doing this. And I'm right dominant. So, all in here is short. All in here in the back is long. So I need that joint to open. So my palm is up and I'm actively trying to feel the top of my shoulder into my neck, also into my scap. I'm just trying to bring my whole shoulder, my scapula down, while simultaneously holding my arm out. Now, I'm gonna do it on this side as well. I'm gonna open my legs a little bit, my ankles a little bit, just so my hips are even, because I can feel that. And where it's very hard for me is on my right arm. Just because after so many years, I've been practicing for so many years, and the amount of hours that I've spent using this arm in a compromised position, it's just gonna be something I deal with for my life. So I'm trying. I feel the backside of my bicep, my tricep, but really along my bicep, and then the back where my rhomboids are. Now you can slowly work in tiny circles, tiny shoulder circles. Because this is what my spine wants. Now I'm starting to feel it on my left side. This is not easy. I'm having a hard time holding my arms up. This is not easy. Gravity is hard. My left side is opening more. I can start to feel it getting closer, opening more, slowly, closer to the base of my scapula, my rhomboids also. So it moves. The feeling that I get is this feeling of tightness that slowly starts to expand into, look, even now I can feel it in my hips at the top of my sacrum. And this is very difficult. This is not easy. That is not easy. Now my arms are tight. But my neck is already more released. I feel this in the front of my neck, in my scalenes. There are a lot of other things that I could do. I could continue doing this for hours. For hours. Final thing, anytime you can sit on the ground, if you can sit, even if you cannot sit crisscross, even if you cannot sit with your foot inside, your foot inside like that, just sit crisscross. You will feel it immediately in your back, and your spine will be so happy. Your nervous system will be so happy. And it might be hard. And look, your body is not perfect. Look at it. Even now, you can see my body is not perfect. It's not perfectly aligned. If it's hard for you to sit like that, you just use something to help tilt your hips. I'm going to use my towel. You don't need, and you'll start to figure out, you'll slowly figure out What feels good, what doesn't feel good. I just want it to help tilt me a little bit forward. So as you can see, I feel that helps a little bit. And it helps release my neck right here. All in here. All into my arm. My jaw. My eyes. My scalp. Always work on both sides of the body. If my leg is crossed on top of my left leg, I'm gonna make sure I switch them. I'm not looking down, I'm not looking up. I'm feeling where, when I move, I have the most length in my spine. Just like they say, like a rope is pulling you up. It's not really like a rope. It's like, imagine you're trying to balance something, and that's your own body. And I can feel right in here where there's really this strong tension. See, my arm's starting to release, my shoulder's cracking. That means this is starting to kind of give way a little bit, which is good. That's my objective. The front of my neck is opening. That's my objective. I can feel it even in my ears. Sometimes what will happen is you'll get like water that drains out of your ear because all of a sudden your alignment changes. Your jaw. Just open and close your jaw and you'll notice that feeling. This is very simple and very powerful. The basics, the basis, the basics and the basis. I'm going to end exactly where I started, even though I could keep going and going and going and going and going and going. There's only one more thing I would do if I was rushed on time. And that is some kind of rotation. Because I want, your spine has all these little muscles and the discs and the vertebra change based on how you twist, because we're three-dimensional beings. We move in all these planes. So the only other thing I would do, there you go. There you go. And as you heard, I just adjusted my own spine. And I feel comfortable and confident because I did that on my own and it wasn't forced. So, hopefully that helps in some small but meaningful, deeply meaningful, and relieving